So today we'll talk about confusion in our older adults. So when you say confusion, you need to know what that means. In confusion, you may realize that your old adult is not their usual self. Sometimes they may be a bit more aggressive. Sometimes they may be scolding someone. Sometimes they may be shouting, which is not normal for them. So when this happens, you need to think in a certain way. Is this something acute, or did it happen very quickly? Or did it take a long duration of time? Has it happened over a few months to about a year? If it's something very sudden, then it could be a sign that they may be having sometimes an infection, like a urine infection or a chest infection or a flu. Because sometimes this could be the only marker to say that the patient has some kind of infection going on. Or if it's something acute, this also may be something more serious, like something wrong in the brain. So it's important to make sure that you tell your doctor about this so they can check your patient, examine them, and come to diagnosis sooner rather than later. But if it has taken a long time, if it has happened over months to about a year, this could be something like dementia settling in. So it's important to take a good history. What is their memory like? Is their short-term memory worse than their long-term memory? Because generally, in something like dementia, the short-term memory is much more poorer than the long-term memory. So these are some important bits that you need to know about assessing a patient with confusion, especially if it's your mother and father. If you see that they're confused, please look into these matters so that we can attend to it at a timely fashion rather than keeping it for long and getting into trouble.